Hello everyone, my name is Tanner Lapointe and I am with the Schizophrenia Society of New Brunswick. Today we're going to talk about a very serious and debilitating illness that unfortunately affects so many people. It's called depression. Although there are many different forms of depression, the one we're going to talk about today is clinical depression. So what exactly is clinical depression? Clinical depression is a biological brain disorder, which is caused by a biochemical imbalance. Clinical depression is different from normal feelings of sadness. It is also different from normal reactions to unfortunate life circumstances. It can be described as excessive feelings of sadness and hopelessness, and it typically lasts for an extended period of time. Clinical depression usually lasts for weeks or even longer. So what exactly does clinical depression look like? What are some of the symptoms? We can break down the symptoms of clinical depression into two major categories: physical symptoms and psychological symptoms. Some of the physical symptoms of clinical depression include extreme fatigue, disturbances of sleep, such as excessive sleep or lack of sleep, lowered libido, pain with no clear medical cause, and catatonic behavior, such as extreme movement, lack of movement, or maintaining a certain position for an extended period of time. Some of the psychological symptoms of clinical depression include feelings of sadness, anger or irritability, deterioration of memory, feeling worthless or helpless, thoughts of death or suicide, and in some cases, even symptoms of psychosis such as delusions and hallucinations. So we know what clinical depression is and what it looks like, but what are some of the causes? What causes clinical depression? Like most illnesses, there is no one specific cause of clinical depression. In most cases, it's caused by a combination of factors. Some of these factors include a genetic predisposition to depression, which is a family history, someone in your family who has depression, extreme stress, lack of positive coping mechanisms. When we speak about coping mechanisms, that's how we deal with the daily stresses of life. We can deal with them in a positive way or a negative way. Having a lack of positive coping skills can lead to depression and negative thinking patterns such as learned hopelessness. So how exactly is clinical depression treated? Is there help for someone with clinical depression? Yes, absolutely. Let's go over some of the most common treatment for clinical depression. As we stated earlier, clinical depression is caused by a biochemical imbalance. As such, clinical depression is often treated with medications. Although there are many different types of medications that can be used to treat clinical depression, the most common medications prescribed for clinical depression fall into a class of drugs called selective serotonin reuptake inhibitors. These drugs work by increasing the levels of serotonin in the brain, bringing them to a more balanced level. Another treatment method used for clinical depression is electroconvulsive therapy, or ECT. Electroconvulsive therapy is a painless medical procedure in which the individual is put to sleep via anesthesia and their brain is stimulated with electrical currents. These electrical currents induce a seizure, which alleviates some of the symptoms associated with depression. Other treatments used for clinical depression include psychotherapy and cognitive behavioral therapy, which are typically used in combination with antidepressant medication and or electroconvulsive therapy. Family support is also very important in mitigating and managing the symptoms of clinical depression. Everybody needs a support system. Getting adequate amounts of exercise and maintaining a healthy diet is also very important in managing the symptoms of depression. So yes, there is help. Depression is actually the most treatable mental illness. Most people recover from depression and lead full, happy lives. If you are struggling with depression, just remember you are not alone. There is help and recovery is expected.